Here are 5 of the best nasal sprays you can get over the counter to treat your allergies. My name is Dr. Rubin. I'm a board certified allergist. Hit that follow button if you want to learn more about your health. When I talk about these nasal sprays, I'm talking about them from the standpoint of broad categories, and it's meant for general educational purposes only, not specific medical advice. The first on this list is just simply nasal saline sprays to help clean out your nasal passages from mucus, allergens, and other debris so that you can breathe a little bit easier. It helps reduce some of the inflammation, and when you use other nasal sprays, those sprays work more effectively because it's going on fresh tissue and not on mucus. Next, there's a nasal spray called Nasal chro, which is cromolyn sodium. That medication can help stabilize mast cells, which help reduce the chances of having allergic reactions. But from clinical experience, it doesn't typically work well unless you are starting it before your allergy season, about 2 to 4 weeks beforehand, because once you start having symptoms, that nasal spray doesn't work quite as effectively. At number 3, I have nasal decongestant sprays. These can help open up the nasal passages pretty quickly, but you do not want to use them for more than a couple of days at a time because it could increase the risk of developing something called rhinitis medicamentosa, where you essentially become dependent upon the nasal spray, and it could cause potentially damage to the nasal septum. At number 2, I have a nasal antihistamine spray that's recently been made over the counter called Astepro. The generic is azolastine. This is an antihistamine spray that can work pretty quickly within 12 to 24 hours. The problem with this spray is it can be very bitter tasting, so you have to make sure you know how to use this nasal spray correctly. And at number 1, I have nasal steroid sprays, which is probably one of the most effective allergy medications that is available over the counter in general. The only issue is that you have to take it several days before you start seeing benefit, and it may take up to 2 weeks of daily use to see maximal benefit. And with any medication that you start, it may be a good idea to talk with your doctor, especially if you have any underlying health issues, before starting so you understand the full risk-benefit profile for your health.